Hello everyone, this is Dr. Saroj Siddharthi from the platform of UKMLA with DSS. So let's just move on to the lecture that we have to deliver today. That is the structure for the ophthalmology stations or the eye stations. Okay, it's very likely that you're going to see an eye station in the exam, and the common presenting complaint that you may see in an eye station is going to be either eye pain or redness or loss of vision or discharge. And the most common presenting complaint that you're going to see is basically the loss of vision. Okay. And one important thing regarding the eye station, that just like the EMT station, it can become a bit difficult because again the eye stations can be a combined station in which you would have to take a very focused history and then move on to examination. Or there is a possibility that they may not give it to you as a combined station, and they just may just give it to you like a simple history taking station. Okay. In either cases, you need to be very well prepared, and you need to be very well versed with the differentials and how to rule out the differentials as early as possible, because even though if it's not a combined station, even then there would be a time crunch involved, because there are a lot of eye differentials, and it can become a bit difficult to diagnose and reach to a diagnosis in the eye cases. Okay. So make sure that you are well aware of the structure, and make sure that it's written down in your notes, and make sure that you have understood it, and make sure that you have practiced it well. Okay. So yeah, as I mentioned, that the most common complaint is either going to be loss of vision, redness, discharge from the eye, or eye pain. Okay. And just like the EMT structure, in the very first layer, you just need to do the Socrates of the eye pain, or the Odipara when it comes to the loss of vision and the redness or the discharge. Okay. And I'm not going to go into the detail, because we have done Socrates and Odipara in a lot of detail in the previous lectures as well. What is more important is ruling out eye differentials. And my advice to you would be to make sure that you rule out the eye differentials on the basis of the history, because when it comes to the examination part, when you go and have a look and do the fundoscopic examination, the kind of picture that you would get on a fundoscopy, it would be very difficult to diagnose the case, because the fundoscopic examination and the fundoscopic pictures are kind of difficult. Okay. And they're very similar in various different differentials. So do not just rely on the fundoscopic diagram or the fundoscopic picture to come to a diagnosis. Make sure that your history is so good, and make sure that your history is so accurate that you are able to rule out the differences, and you are able to come to the diagnosis just on the basis of your history. And the examination part is just something that you do for the sake of doing the examination, or just to ensure and just to further get more confident on your diagnosis. Okay. So we'll discuss the differentials and how to rule them out. Okay. And let's start off with the differentials of vision loss. Okay. So the most common differential in the vision loss would be glaucoma, in which there would be a painful loss of vision. Okay. So after you're done with doing the OD-para of the loss of vision, the first question that you need to ask about it is that is it a painful loss of vision, or is it a painless loss of vision? Okay. And then the very important question that will help you rule out glaucoma is that, is there a history of watching screen in the dark? Okay. Maybe the patient would have a habit of using a cell phone before going to sleep with the lights turned off. Okay. Or maybe there is a child who has a habit of watching television in the dark. Okay. So that is one risk factor that you need to ask. Number two, you need to ask, do you feel colored halos? Okay, what are halos? Halos are basically colored lights that you see around your vision. Okay, so you got to ask about the colored halos. Okay. And then later on in the history, you would be getting the use of amitriptyline or salbutamol for depression or for asthma. Okay. But the two most important thing that will help you rule out glaucoma is the history of watching in the dark and colored halos. Painful loss of vision will not help you rule out glaucoma, because painful loss of vision, as you can see below, it's in other differentials as well. Okay, so make sure that you ask this question, and you make sure that you are ruling glaucoma out by asking these two different questions. Okay, then the other differential is optic neuritis. Okay, how are you going to ask about that? If there is a painful loss of vision, then you're going to ask this particular question, that are you able to differentiate the different colors? Okay, like for example, are you able to differentiate the colors of the signal, traffic signal, red, green and yellow? Okay, so are you able to appreciate two different colors, that okay, this is orange and this is white? Okay, so are you able to differentiate the colors? Okay, and if somebody is not able to do that, it is most likely that this patient may be having optic neuritis. Okay, and then later on in the history, you may be getting a history of giant cell temporal arteritis, or multiple sclerosis, that may be there in the history. But what one particular question that will help you reach out to the diagnosis of optic neuritis is basically the unable to differentiate different colors. Okay, then the third differential, that is retinal detachment. Okay, along with the painful loss of vision, you gotta ask about that, was there any recent trauma or any eye surgery? Okay, that is what the risk factor of retinal detachment is. Okay, if somebody has a recent trauma, or any cataract surgery recently, or any eye surgery. Okay, most likely in the exam you're gonna see that the patient must have had a cataract removal surgery. Okay, and then they would present to you with painful loss of vision. Okay, then the fourth differential that you need to rule out is basically the loss of vision along with any glares that might be coming during the night. Okay, so if somebody is having problem at night vision, okay, and somebody experiences some glares, okay, then it's most likely that they have cataract. Okay, and the cataract would be a painless loss of vision. Okay, and then later on in the history, you would find that the patient has some steroid use, and patient has an advancing age. Okay, or maybe the patient is using methotrexate. Okay, some the immunosuppressant drugs basically. So but that one particular question that you need to ask at this stage is that, do you feel any glares at night? Okay, then there is another differential, that is toxoplasmosis, in which there is loss of vision. And in that particular case, you're going to see that the patient may have had any interactions with animals. Okay, so the patient may have some pets in their home. The patient may have some interaction with the animal. They might be working in animal services. Okay, but they would be interacting with animal, and that is something that should raise the suspicion in your head, that okay, this patient may have toxoplasmosis. And in later on in the history, you may find out that this patient is immunocompromised or has HIV. Okay, then the next differential that you should rule out is basically age related macular degeneration. Okay, in this there would be loss of vision. Okay, and the one question that will help you rule it out is basically that, are you seeing the lines get wavy, or are you seeing waves while you are reading a newspaper? Do you feel that the letters are written in a wave form whenever you are reading a newspaper? Okay, and if there is an advancing age, and if the patient is old, like more than 65 years of age, and having loss of vision with wavy lines, then you may think about age related macular degeneration. Okay, then if somebody complains of vision loss, okay, then ask about it, that okay, is it the central vision that is being lost, or do you feel that you're not able to see the sides? So the peripheral vision loss is like really really important. Okay, and the patient may just come to you with the complaint that they are unable to see when they are reversing the car, and they keep on hitting the edges of the car, and the reason is that they are unable to see the peripheral vision, and the peripheral vision is being lost. Okay, and the central vision would remain intact, and that happens in the condition called bitemporal hemianopia. Sorry for the slip of tongue. Okay, but yeah, you need to ask about the loss of peripheral vision. Okay, then retinitis pigmentosa. Okay, if somebody says that okay, we are having vision loss, okay, and all of these things, are like negative. You're going to ask about that. Do you feel that you lose your vision at night time and it comes back again in the morning, and in the daytime you are able to see completely fine? So they're going to say yes to this answer. And if they say yes to this particular answer, that means that they are having something called the retinitis pigmentosa. Okay. Then if somebody presents to you with loss of vision and you do not find anything else over here, then there would be a history of uncontrolled diabetes mellitus. Okay, that you may just ask at this level, or you may wait for the meftosa part to ask it. It's completely up to you. But in order to rule out diabetic retinopathy, you can just ask about this question as well. Okay, and even in the cataract as well, there is a possibility that the patient may have diabetic, may have the history of diabetes. So you need to make sure that if the history of diabetes is there, you don't just blindly go with the diagnosis of diabetic retinopathy, because a patient of cataract can also have diabetes and end up getting a cataract instead of or getting a diabetic retinopathy. Okay, so these are the like 10 questions that you need to ask when you're ruling out the differentials for vision loss. Okay, but there is a possibility that patient may present to you with redness in the eye. Okay, and in that particular case, you just going to do the Socrates. Okay, and you got to ask about that. Apart from the redness in the eye, do you have any vision loss? Okay, so make sure that even though there is the present company is just redness, you ask about these four symptoms as well. Okay, like for example, is there any loss of vision? By any chance, do you have any discharge? And by any chance, do you have any pain in the eye? Okay, so after you are done asking these three questions, then come to rule out the differentials of red eye. Okay, and the differentials of red eye is number one, scleritis. Okay, uh, the red eye in case of scleritis would be a painful red eye. Okay, you need to make sure that and there would be the history of some autoimmune conditions like ankylosing spondylitis, IBD, or use of methotrexate. Okay, so make sure that you are asking about these questions, and you are asking these questions directly to rule out the possibility of scleritis in a patient with painful red eye. Okay, uh, then the other case is keratitis. It's usually lens induced. Okay, so if somebody presents to you with painful red eye and they don't have any autoimmune history or any use of drugs like methotrexate, then you can just ask about the second question, that is, by any chance did you recently use contact lenses? And they would say, yeah doctor, we I used contact lenses last night after coming from a party. I just slept without taking them out, and that is why the patient would have a very very painful red eye. So that means that this patient is having something called the keratitis. Okay, then to rule out conjunctivitis, the patient of red eye would have a itchy red eye. Okay, so you got to ask about that. Okay, is the eye itchy? Okay, and if the patient is having a severe itch, then that means that patient is having conjunctivitis. Okay, then there is another case of red eye in which there wouldn't be any pain, there wouldn't be any history of use of lenses, or there wouldn't be any itch, but just a red spot would be there in the eye. Okay, also known as the bloodshot eye or the subconjunctival hemorrhage. Okay, and this is common in those patients who are on blood thinners. Okay, or those who have bleeding disorders, or those who have had a recent trauma to the eye. Okay, so in the red eye cases, after you're done with asking about the other differences like other symptoms like eye pain, loss of vision, and discharge, you're going to ask about autoimmune, use of lens, itchy, and if you're not able to find anything amongst these things, then ask about blood thinner medications, ask about bleeding disorders, ask about any history of trauma. Okay, and it's completely up to you. You may ask these questions over here as well, or later on in the meftosa as well. Okay, so that is completely like your choice. Okay, then if there is any other symptoms and there are other cases of eye that usually shows up in the exam, and you should know just on the basis of one question and one symptom, then what the diagnosis is. If somebody is presenting to you with any eye complaint like loss of vision, pain in the eye, or redness in the eye, and there is a rash on the face as well, okay, that means that this is ocular herpes. Okay, then there's a condition called arcus senilis, okay, that is linked to high cholesterol and fatty rich diet. Okay, so you got to make sure that you ask this question in arcus senilis case, that do you have a diet that is rich in fat food or fast food. Okay, then a condition of the eyelid may present to you, in which the patient may say that, okay, doctor, I have some problem with my eyelids, I have difficulty in opening my eyes. So we're going to ask about that. Okay, do you have any dry and dirty eyelids? Okay, if that is the case, then it is most likely to be a case of blepharitis. Okay, so you see, there are like numerous differentials of eye, and when there's a time crunch involved, and when you have to examine the patient as well, so it kind of get difficult if you're not very well aware of the differentials and how to rule them out. Okay, and what are the questions that you need to ask. So I have made it very simple and very easy, that that what are the questions that you need to ask, and what is that one particular thing that will help you rule out a differential, because that is all you need to do. Okay, very quickly you need to just ask directed questions. Okay, and you need to have a very very differential oriented approach to make sure that you're ruling out the differentials properly, and you are coming to the diagnosis as soon as possible. All right, yeah. Now, coming to the last section of the structure of the ophthalmology, that is P meftosa. Okay, so some of the questions of the P meftosa part you may have directly asked when you are, ruling out the differentials. But if in case you haven't asked them, I'll just share it with you. Like for example, the past medical history, you can ask about these diseases. Like for example, if somebody has GCA or multiple sclerosis, you are thinking about scleritis. In the patient of diabetes mellitus, you're thinking about cataract and diabetic retinopathy. In the patient of depression and asthma, you're thinking about glaucoma. Somebody with HIV, you're thinking about toxoplasmosis. Recent eye surgery, you're thinking about retinal detachment. Ankylosing spondylitis and IBD, like I can understand that you're thinking about scleritis again. Okay, bleeding disorders, you're thinking about some conjunctival hemorrhage. Okay, so all of these questions, may have just asked it like in the section above, but if you haven't, then you may just ask direct questions about these disorders in the P part of the P meftosa. Okay, then same goes for the medicines, amitriptyline and salbutamol leading to glaucoma, steroids and methotrexate leading to cataract, and methotrexate alone leading to scleritis, and then blood thinners leading to subconjunctival hemorrhage. Okay, so just make sure that you are asking these questions either in this particular layer, or if you have missed out on something, you just know that, okay, I have to do meftosa, and then you ask about the risk factor over here if you've missed it in the section above. Okay, then you may ask about allergies when it comes to the case of conjunctivitis. Okay, other cases it may not be relevant, but if you are experiencing a red eye that is itchy, then asking about allergies is a very very relevant question. Okay, then family history may not that be important, but travel and trauma, okay, they are like, both of them are like really important. Okay, T for travel, T for trauma. Trauma for retinal hemorrhage and retinal detachment and subconjunctival hemorrhage, and recent travel may lead to conjunctivitis, because allergies are like really common in those people who have recently traveled, because of lack of hygiene in the hotels they stay, and in the airlines that they use. Okay, then the psychosocial aspect would be important, because like somebody is losing their vision, they wouldn't be able to see for a long time. Okay, or they may not be able to see for some time. Okay, so they would want some support, they would want some person to be there with them. Okay, so make sure that you ask about the psychosocial aspect, and then in anything else pass about the driving and occupation becomes important, just like the EMT cases. While driving, because somebody is having difficulty in you know seeing and has some loss of vision, obviously they won't be able to drive very comfortably. Okay, so you would have to give some driving related advices, and you would have to maybe involve the DVLA as well. Okay, so you make sure that you ask that, do you drive? And if the patient drives, and if they have visited you after driving them on their own selves, then make sure that you don't ask them to carry their car to the A&E. Make sure that you ask them to call someone who can carry their car, and they themselves can go on a public transport, okay, and maybe you can arrange a different transport for them, okay. So the driving related devices are like really important, and so is the occupation, because like a person who has had a loss of vision, or maybe the person who would need an eye surgery, okay, and if they are working on a desk job, if their job requires them to look at the screens, okay, then you may have to give them some advices on taking an off from work, okay, or if maybe they're working out there in sunlight as a construction worker on the roads, okay, or at construction sites, okay, or maybe if they're working at a very dusty area, like for example the construction worker, they have to get exposed to a lot of dirt and a lot of dust. So you would have to give some occupation related advices as well. So make sure that you're asking about the occupation whenever it comes to the eye cases, just like the case in which you ask about it whenever somebody comes to you with an ear complaint. Okay, so yeah, that is what is the right way to go about it, and if you follow this way, you would be able to do your data gathering in a very time efficient, in a very time effective way. Okay, and this way there wouldn't be any differential, and there wouldn't be any case that you miss. Okay, so all of these things that I have taught in the specialty section, it's just the structure that you need to follow. There are like numerous specialty cases like out there, so make sure that you read all the notes, and make sure that you have read the management. And as far as the management of these cases are concerned, it's always through the IRMAS or the RIMAS protocol that I have taught, because at the end of the case, you're just coming to a diagnosis, and you have to manage the particular case. Okay, so just follow the IRMAS protocol or the RIMAS protocol whenever it comes to the management of eye cases and ENT cases. Okay, so that's pretty much it from my side. If you got any questions and any queries, drop them down in the comment box below, or drop them down in our DMs on our social media. I would love to address all your concerns. And if you want to schedule a personalized mock with us, then scan the QR code for more details. That's pretty much it. See you in the next lecture.